Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, happy Friday. You are tuning into Back into Alignment. My name is Joa Rivas, and I am the host of this podcast that we host every Friday. We have guests from all over the world that actually are healthcare professionals that are dedicating the time to bring awareness, solutions, and strategies for us to walk taller, to feel less pain in our body. This podcast is dedicated for people that actually have some type of condition that they are dealing with. It could be something that it just appear from a wear and tear, or it could be also related to a congenital issues. Like we talk about so many different approaches of how to target the issues that can affect us. And perhaps you are now super healthy, but maybe your parents or maybe somebody in your family or your friends. So this is actually dedicated for the entire community around the globe. So today we have our last talk with the physiotherapist Dave Ross. He's the director of Eramosa Physiotherapy. We have been talking for 3 weeks in a row, chatting about topics that are actually concerning our lifestyle. We are talking about back pain. We talk about how to decrease the back pain and how to implement simple tips every day to reduce the possibility of having neck pain. And we also chatted about osteoarthritis, obesity, and lower back pain, and they all related together. Today, we're actually kind of going to another direction, which is actually the vestibular system. Have you heard about vestibular system? Well, we're going to be chatting about that today. And first of all, let's just welcome Dave Ross. How are you?
I'm good, thank you. Yeah, it's been a good week. How about yourself?
Yes, I see that you are wearing the orange bow, and I think this is related to the Truth and Reconciliation Day. Tell me about how do you feel about today, Friday?
Well, it's mixed emotions. We work in Guelph area is the clinic where I'm based out of, but we have clinics even further north, and we do service people in the Native communities. And I was actually talking with one of my clients earlier today about this. I feel like this year, because of all of the reconciliation efforts and the things that have been done over the last 12 months, things are a lot further along and progressed from where they were last year. Last year it was a very raw topic, right? Because of all the discoveries that they made around the schools. So there was a lot of hurting people, and because we treat people from the reserves, we were actually seeing that and how it was even affecting their bodies and stuff. And even though they had never been to any of those schools, family members or people from their community had, and it was interesting, not interesting, but terrible to actually see how it affected them. So
yeah, so today, for those that are connecting from other countries, we're actually in Canada, and we celebrate today the day that is called the Truth and Reconciliation, coming together with the Native community. And that's why Dave is sharing about how he is connected to the reserve community in Guelph in Ontario. So yes, beautiful. Thank you so much for bringing awareness about this topic and bringing union at the end. That's why we're trying to avoid division and controversies, just try to bring our communities together, no matter what color or any type of inclination. We're just all the same. So yeah, thank you for bringing that awareness. And now coming back into our discussion today, we're going to be chatting about vestibular system. Vestibular system, a link between the inner ear and your brain. It's basically the way as we maintain balance. Sometimes we don't think about this particular very important piece in our body, which is how can we maintain our posture and our balance. Basically is a part of our brain. And I actually, last year, I completed the program from the Posture Pro program that it was called the Brain Coach Performance. And actually allowed me to go deeper into the connection on our body through our spine, through our brain, and how this can actually affect us. You may have felt vertigo, or you may have felt at least once in your life a little bit dizzy from one reason or another, but perhaps it could be something related to your vestibular system. But here we have a professional that is actually bringing a lot of content into vestibular rehabilitation. So please, let's start from the beginning for those people that don't know what the vestibular system is. What is vestibular system?
Our vestibular system is actually a part of the inner ear. So our ear is divided up into three separate areas. You've got the outer ear, the middle ear, and the inner ear. The outer ear is just the part that goes in there. So that's where the sound comes in. It kind of gets tunneled in. The middle ear is from where the eardrum is. Most of us know where the eardrum is. Then just behind the eardrum, there's actually three little bones. And those bones take the vibration of the sound from the eardrum and they transfer them across the space into the inner ear. And so those bones take up what's called the middle ear, that space. And then the inner ear is actually within the skull bone of our head. And that's broken down into three main areas. And I can get really technical, but I won't so that I don't bore everybody. But it's basically three areas. The first area is kind of a snail shell part, and that has a whole bunch of hair cells of differing lengths, just like our fingers, and differing widths, and they vibrate with different frequencies, and that's actually how our brain senses sound, those vibrations of those hair cells. If we move a little further back into the inner ear, there's a kind of a blobby center to it, and in there's a whole bunch of hair cells sticking up with kind of a jelly matrix over top of it and crystals set in amongst those. And when we accelerate forwards or backwards, what happens is the crystals kind of roll forwards and back, bending those hair cells. And when those hair cells bend, they send a signal to the brain saying we've moved forwards and backwards. So if you've ever been on one of those roller coasters where they take you and they fire you forwards and then they pull you back, for those of us that are from Ontario, there's the bat at Canada's Wonderland is a great example of that. You go through it forwards and go through it backwards, it's flipping you around. Those sorts of things work with that part of the system to give you lots of stimulation for your inner ear. And that's why some people feel great because their systems are well balanced, and other people feel terrible and they want to go and throw up after that because those systems are damaged. And then if we move to the very back of that thing, there's three canals. And there's one canal, it's kind of like a tube. It goes forwards and back like this. And that would sense our kind of frontwards plane movements. There's another canal that goes front to back like this. And then another one that goes horizontal. They don't line up perfectly in those planes, but for our purposes, that's kind of how we look at it. And so normally that system or that part of the system works by a really thick fluid, kind of picture like a motor oil that flows through there, and there's a pocket of hair cells, kind of looks like an onion, kind of floating around, and that fluid washes over the onion of hair cells, and that's how we sense movement in those rotational planes. And so that gives it, all of those things give information to the brain through the nerves to tell us where we are in space and how we're moving through that space. So hopefully I didn't put anybody to sleep with all of that.
Yes, thank you so much. It's a very complex system, as you hear. Thank you so much, Dave. You try to explain it as you would explain it to your daughters. And it's important to always have a easy way to just explain something that is so complicated. But it's actually very important to know that if a disease or an injury damages this system, then you can develop a disorder, right? So that's actually the talk that we're gonna now bring is related to what happened if something happens in this particular system. So now that you actually have a vestibular rehabilitation, can you please tell us about what is the typical symptom that the people come to visit you, and what type of normal treatment you start implementing to reconnect this path that is so complex?
Yeah, so probably the main thing that people come in and say is, or even on the doctor's referral sheets that come through the door, is vertigo, right? We all have heard the term vertigo. Vertigo is actually a symptom. It's not actually a disease or a disorder. It's a symptom that could be from many different problems. So vertigo is a spinning sensation. It can be spinning around, or it can feel like you're staying still and things are spinning around you, or it can feel like you're flipping forwards or flipping back. And that depends on where the damage is and what the actual problem is. The main thing that we see in vestibular rehab, and the easiest thing for us to treat, is benign positional paroxysmal vertigo, or BPPV for short. That is super easy to treat. Average number of treatment sessions is 3 treatment sessions, and people are 100% recovered after that. Of those people, then 20% of people will get it recurring throughout their life, and 80% will not. So what happens with that particular injury or illness, if we want to call it that, is the crystals. Remember I said in the middle of the inner ear, there's that blob that has the crystals. They go on vacation and they pop out into those tubes that are in the back that we talked about, the ones forwards and back, side to side, and rotation. And while they're hanging out in there, what happens is, you can imagine if I'll use a pen lid. If I'm in the circle of the crystal and I lie down, so now the crystal is going to get pulled all the way down to the bottom with gravity. So during that time period while that crystal's falling through space, that one ear that has the crystal in it is telling my brain that it's moving, even though there's no movement at all. The other side of the brain is saying there's no movement, and the brain doesn't know which ear is right and which ear is wrong. It just knows that one side's saying you're moving, the other says it's not, and that's when the world starts to spin. Till that one crystal comes to rest, gravity pulls it all the way to the bottom, and now you feel fine again. So most people, that lasts 10 seconds, 15 seconds, and then they're good again. And then they go, and then when they get out of bed in the morning, whoop, they stand up and whoop, that crystal falls back down and they feel terrible for a few seconds, and then they keep their head really still. So sometimes people come in and they move like this because they're very afraid to do any movement because it triggers that crystal rolling around.
Okay, yes, okay, so this more like, it's a very sensitive part as we hear, and very delicate, and we don't know until we actually passing through some type of disorders. Learning the effect of vestibular stimulation on eye-hand coordination is something that we will be chatting in the future. Remember that understanding the role of the motor control and the global health, actually, this actually can be affecting many people. I've been hearing people having like motion sickness. They may have some type of dizziness, or they blame it on the blood pressure, but maybe it's not the blood pressure, maybe it's related to the ear. So do you actually receive some of your patients that actually confused? I don't know if it's actually something related to a blood pressure thing, or it's actually related to the ear.
Yeah, and that's a really easy thing to distinguish, actually. So if it's blood pressure, it will only happen when you get up. It won't happen when you go down. So by that, I mean, when you go from a lying position, like lying down, and then you get up, that's when the blood pressure will drop. But if you get that same person and you lie them down quickly, they won't get dizzy at all. So that's a really easy thing to test out. And sometimes we do get people that come in, they're doctors. Some doctors don't have a lot of background on vestibular issues or whatever, and so they'll send them to us and we'll figure it out, and we'll give them tips on how to control their blood pressure and how to help them with that, and then they can talk to the doctors about that as well, and they sometimes need medication, and then everything gets back on track. Again, these are all things that are relatively easy to treat. In those people, we tend to take more of a diet, nutrition approach rather than just specifically doing rehabilitation exercises. But, yeah.
Very interestingly, I am a yoga teacher, and we do dedicate at least 5 minutes of every yoga class balance, right? So because balance is something that it gives us the sense of stability, we get to challenge our core muscles, but at the same time, deep inside, we're actually working the balance through our vestibular system. So I noticed that some people have a better balance in one side than the other, especially when we practice in yoga poses, holding a warrior or holding eagle pose. So my question is related, when someone struggles with balance in one side, is that connection on the vestibular, or it could be more of a lack of a core awareness?
The simple answer, yes. But more detailed is it could be both, it could be one, or it could be the other. So if somebody comes in and they have poor core stability, and or maybe they've got a bad knee on one side or something that's not connecting through there properly, then that's going to throw off their balance. We get our balance actually from three different things: what our bodies touch, what our eyes see, and what our inner ear feels. And so if any one of those three things is off, be it the core stability where our body's kind of touching itself and also controlling itself, that can throw off. If somebody has diabetes and they lose sensation in their feet, that can throw their balance off. And that can actually be more one-sided than the other. Yeah, or if somebody all of a sudden has bad vision, or if they're blind, that affects, it doesn't, you wake up in the middle of the night and you walk around in the dark, it doesn't take you long to figure out that you're a little wobbly and you'll want to hold on to the furniture.
Okay, so it could be a combination of many factors. Now, coming from someone that actually delivers this type of therapies, the vestibular rehabilitation therapy, there are four main goals. The number one is enhance the gaze stability. Number two is to enhance the postural stability. And then three, improve vertigo. And four, improving daily living activities, which is why we were chatting, especially like when we do yoga, that's when we realize how imbalanced we are, or if we have more awareness in one side than the other. I constantly remind my students to have an eye gaze in a point that is not moving. So try to avoid looking at me or at the mirror or something that is moving. Just try to keep your eye gaze in something that is static. So let's chat a little bit more about how to enhance gaze stability.
So by gaze stability, we mean being able to keep our eyes focused in one place at one time. So with that in mind, one of the things you want to do, or you can have somebody check this on yourself, is actually looking at a target. So it could be a finger or something moving along the screen. So actually tracking that object. So if you see my eyes following my finger there, right? That's actually a very simple exercise to follow. And so you can use something like a screensaver on your computer that will bounce around and follow that with your eyes. You can also, there's really good exercise where you look at a thumb or a fixed object in front of you and you turn your head back and forth while you keep your eyes focused. Different exercises will apply to different people based on what's going on with them. Some people, when they try to follow a moving object, their eyes will actually skip rather than following it nice. It kind of looks jumpy. So in that case, you'd want to be following a moving object. Other people, when they stare at something, their eyes kind of wobble back and forth, and they're not able to maintain that. In that case, those people would want to be keeping them there and doing it both. If you're not sure, do both exercises. They'll help no matter what. So
yeah, exactly. Actually, if you go into my channel, you can actually access eye saccades. So eye saccades movements are actually specific patterns that you can follow. Like imagine an infinite, for those people that are actually listening to this as a podcast audio. Simply imagine an infinite symbol, and if you can track the infinite symbol, it's very tricky because we think that the infinite symbol have two directions, but it's actually one direction. It's just a little tricky, but you just have to look where you start. You can start on the top or on the bottom. The whole idea is to keep the eye gaze into the ball. Let's say you can follow like a ball, or like imagine that you're actually drawing an infinite symbol. You can do saccades, horizontal, vertical, diagonal, and that all will stimulate your eye gaze stability. Now let's move into the next one. What about the postural stability?
yeah, well, this is where your yoga comes in, Pilates, any of those sorts of exercise programs are very posture focused. Physiotherapy treatment as well. So a lot of the people that I see, I work on posture with them too. If your posture is off, you're going to be leaning towards things, and it's going to put you in a balanced, compromised position. So if you're leaned forwards, all of a sudden your center of gravity is now leaning out over your toes. if you're vertical, your center of gravity goes down between your feet, and then you have an easier time balancing because you're not always falling forwards.
And
Yeah.
what are some of the factors that can affect the recovery of the of someone that is actually experiencing a vestibular disorder?
Oh, there's a lot. It depends what the cause of the actual disorder is. So, if it's the crystals rolling around, that's, like I said, really easy to fix. If it's a blood pressure issue, you need to get either more fluid retention or something like that so that they can maintain their blood pressure. A lot of vestibular disorders are caused by an imbalance, like a fluid imbalance within the inner ear, or a virus or bacteria attacking the nerve. So those are the people who take a lot longer, because you can't just reach in and give the inner ear a massage or loosen up the nerve or try and promote it. We have to use these exercises like the saccadic eye movements and the different gaze stabilization, those sorts of things, to try to get the system to adapt and get the nerves to grow back where they've been damaged by that virus or bacteria. So those people, they tend to take a lot longer. I've seen some people, they get better in a couple of weeks because they're young, they're healthy, they bounce back really fast. And then I've seen other people where, they're more in their 70s, their 80s, their body's not able to fight those things off as quickly, and it just takes them, sometimes several months to recover.
So what's the typical time for someone to recover from vestibular disorder, or it all depends of the level?
Yeah, it depends what the cause of the disorder is. So that's a hard one to really answer. Again, it would go back to what the cause is. But
and the trends are usually affecting both women and men equally, or you see more women?
I've never noticed a difference. Again, I know in previous podcasts, you and I have talked about more women are seeking health care because they would rather just deal with things and get better. Whereas a lot of men, there's the stigma around being macho and not seeking help. And so in the clinic, we definitely see more women, but I don't necessarily think when we look at the literature that that's reflected in who is actually having the symptoms.
Yes, wow. Yes, so this is actually interesting, the vestibular rehabilitation. When you receive somebody with this type of issues, the typical support is like a 30 minutes exercise rehabilitation. How long does it actually take to start seeing results?
Again, it depends on the cause. So if it's that crystal floating around in the inner ear, we do an hour-long assessment and treatment, sometimes a bit longer, depending on the person, and they can be instantly better. If it's just one crystal and we get it back into the center part of the inner ear, there's different treatment techniques that you do for that, where you kind of put the person in a series of positions to manipulate it through the canals. When you do that, some people walk out of here and they'll call me the next day and, Dave, I'm 100% better. I don't need to come back. And that's wonderful. Other people where the virus has attacked the nerve and they've got to wait for more nerve regeneration and stuff like that, they can take 3 months, 6 months in some cases. That's a lot slower.
And for the typical people that actually have vertigo, the therapies are usually the same, like eye gaze stability, postural stability, or what would be the best approach to support someone that has vertigo?
Again, that depends on what the cause is. So the best thing is to do a really thorough assessment and have somebody who actually knows the different things. One thing we haven't even touched on is you can actually get vertigo from your neck. People can have so much tension in their neck. The nerve for the upper trapezius muscle goes in right beside the vestibulo-ocular nerve into the brain. And if that nerve is kind of overloaded by having a really, really tight neck, it can almost jump the tracks, so to speak, and trick the brain into thinking that they're dizzy. And so those people they get better really well with just doing neck stretches, and we work on their neck. So again, it comes back to doing a thorough assessment, thorough history, and doing all the checks to figure out where the problem comes from. And then the treatment goes according to that. Because if somebody comes in and the problem is the neck, they don't need to do any saccadic eye movements or gaze stabilization because they're going to be fine with the neck treatment. So
okay, yeah, super interesting. Well, as a yoga teacher, I actually learn a lot, especially when I do those balances. This is not simply happening from a loss of the core muscles. It actually could be related to deficiency of activation of the vestibular system. As we are so interrelated with our brain, this is such an important, crucial part of our body. So it was excited to be bringing this new topic. Perhaps for you, you may have some type of issues related to this. Actually, I got a couple of people asking me to bring this topic. That's why I brought it. It's the first time we talk about vestibular system, which is very complicated, and you explained it so easy. So thank you so much for making it so simple to understand all the layers that we have on the ears. And one thing that I hear is never bring anything inside of the ear. It's actually such a delicate part of our body, right, Dave?
Yeah, please don't. Don't stick a Q-tip in there and hope for the best. That is not a good idea.
No Q-tip inside. It's very dangerous, actually. So thank you, Dave. We have you for a whole month having conversation. Thank you so much for your time sharing with us. I will be adding in the chat box how to find you in the clinic of Eramosa, right in Guelph. And if you want to also contact him, we have his Instagram also in the chat box. He is constantly bringing educational webinars for everyone in the globe, so you can have access to his education. He also has Q&As for people that have particular questions. So thank you so much for bringing this knowledge to us. And I'm looking forward to talk to you perhaps next year. I'm going to put together all the doctors that I have interviewed in one summit, kind of, so everybody can get to share their knowledge and get to meet people from other parts of the world sharing the same passion to support our community to feel and to move with high quality. So which is the most important, is to be able to decrease pain and to be happier. So thank you so much. And remember, don't wait to have pain to come to visit the proper professionals. Perhaps we can start developing that preventing medicine instead of just getting when we actually is too late. So thank you so much for all your knowledge infused in this podcast and your energy. Have an awesome weekend. I heard you going to the Blue Jays, so please have fun watching the baseball game and connecting to your community. So thank you so much, Dave. Anything that you want to share, if you have a special event happening, please share with us.
No special events in the near future, but yeah, if anybody wants to get a hold of me, email at Dave, D-A-V-E, at aramosafysio.com is always a good one too, because that goes straight to me. And then I'd be happy to answer any questions about vestibular rehab. And there's a great website, actually, maybe we can post in the notes too, if you don't mind.
Sure.
Vestibular Disorders Association, VITA, is for, I'm pretty sure it's North America, maybe even other parts of the world as well, where practitioners who are registered to treat vestibular disorders, you can find people close to home. They have a tool to search out therapists. So it's
100%. Yeah, I will add that website. Vida, it sounds like life in Spanish. So that's an easy thing to remember. Okay, thank you. Okay, awesome. Let's just connect very soon again and continue learning from your practice and all your knowledge. Thank you. Have a beautiful weekend. And remember, everyone, remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.